Mavoriban, and we will continue to the lecture 3 of a clinical trial. So, the final thing that we discussed it before is the end points. So we have multiple types of the end points. The first one is primary end points. It's a central equation basis for the design and the sample size calculation. Like, it's the basics and we can know it from its name, primary endpoint. So the central equation basis for the design and the sample size calculation, like why we do this clinical trial and why we design it like that, and what is the what is the calculation of the samples, and all this stuff. And it also addresses the primary objectives of the trial, like what are the primary goals of these trials and all this stuff, and assessment of the main clinical benefits of the treatment, like what are the benefits or what are the clinical benefits and what is the goal of this treatment. So I think the primary endpoints is the basic, is the most important thing. So it's central the question basis of the trial and the sample size calculation. It addresses the objectives of this trial and assessment. What is the benefit of this treatment? And then we go to the secondary endpoints, which is relate to the primary endpoints, and maybe like the primary endpoints is the main focus, the main objectives, but sometimes there is secondary objective. They are not the basic, but maybe we can do this stuff, and that's exactly what is exactly secondary endpoints. And then the exploratory endpoints, that during this trial, and we have expectation on something that is happen, like a new hypothesis or a new drug or a new effects or a new side effect. So from its name, exploratory endpoints, like we discover something new that is not expected during this clinical trial. And there is something is called the surrogate endpoints, and we wanted to know what is a surrogate endpoints. Actually, the surrogate endpoints is like a prediction, expectation, how it's affected in the real world health. So, for example, if we are study a cancer disease and we want to know if this treatment causes some effect, like tumor size, for example, and then we see during this clinical trial we have seen like there is a tumor shrinkage and there is a reduction in the size of the tumor, and that means it's a long survival of these patients, or they can maybe live longer. And that's exactly what is a surrogate endpoint. A surrogate endpoints it like a prediction how that is affect in the real world health. Composite endpoints is a combinations of multiple endpoints which gives a real outcome. It will gives more precise outcome and more precise results. So that is an important for composite endpoints. And there is something is called event or outcome driven trials, and that's mean I can discuss it by the example. If we wanted to study the heart disease, and we wanted to know if that it causes heart attack, and we wanted just to know how this heart disease causes heart attack, and we manage it to the 100, for example, heart attack, whatever the time is it. That's mean we didn't give the time period for it. The event is you can leading us. Okay, the event leading us, like I just waiting for 100 heart attack. If that is happen after 2 years, then the trial stop. If that is happen after 3 years, then the trial stop. That's exactly what is the event outcome driven trials. Like the outcome or the event that we predicted, it leads the trial. especially with the time of it. So again, the examples of the endpoints, we have primary endpoints, we have secondary endpoints, we have also exploratory endpoints, we have surrogate endpoints, composite endpoints, and also there a type of a trial which is non-event driven trial or outcome driven trial, and we can understand it from its name. And then the characteristics of the endpoint measures. What are the characteristics of endpoint, whatever it is it? The first thing is clinically relevant, like what is happening in the patient that is relevant to the clinic and easy to diagnose it, and free of the measurement error, reliable with the repeated measure. We do the repeated measure so we can make sure that there is no measurement error. Internal validity and external validity, and we explained it before that internal validity should be the measurement, how it's got the measurement tool, how it's accurate that we do that. And the external validity can be generalized. That's mean generalizability. That's mean how that is get its effect to the wider population. So again, maybe we can say the characteristic of the endpoints, it's somehow that is related also what are the outcomes of the clinical trial, or what are the characteristics of the outcomes of a clinical trial. When we said significant, relevant, internal validity, external validity, that's exactly what we mean here. It's clinically relevant, it's easy to diagnose, we have to make sure that there is no measurement errors, and absolutely that's mean internal validity and external validity. So it's important that the characteristic of endpoint measure should be clinically relevant, easy to diagnose it, free of the measurement errors, internal validity, and the external validity. Now we go to the sample size calculations, like how we determine how many members should be in the group, what is the design, and all these things. Uh, the number of the patients needed to detect expected effect size and required for analysis significance testing for the data. And again, I said the number of the patients, which firstly happened in the phase 1, needed to detect the expected effect size. Like I know, for example, 14 members of the patients, they will give me the exact effect that I want to, and they are requiring for significance analysis testing of the data. Also defined in the statistical analysis plan before the start of the study. We should analysis why we do that, why we choose this number before the start of the study, before doing anything. Sample size too large, unnecessary risk exposure and cost. Like why we do these large numbers of the populations or of the samples, that's lead to more risk, more cost, and that is unnecessary to do that. And there is something else. If the sample size too small and it's in a conclusive study, that it's not precise enough to make the sample size too small. So it will be depend. Actually, I don't know exactly what the statistical analysis they do that and how they determine what is the number of the sample, but just to make sure that the results are precise. So, and in the same time, we don't expenses more time, more risk, more exposure. So the samples should be not too large, not too small. What are the requirements for the sample size calculation? Estimated difference of the effect. Large effect, so we need a small sample size. Estimated the variance. Large variance, so we have large sample size. That's exactly what we mean exactly by the requirement, okay? Desired power, high power, so large sample size. Probability to detect difference of interest. Require significance level, like low type 1 error. So low type 1 error, I mean here randomized error, so large sample size. As we say, to reduce the randomized error, we make the sample more bigger. These are the requirements. These are that control how many members it will be in the group and how many members that it will be in our sample. So again, these are the requirements. If I want to know if this drug, I mean, it has a large effect, so it's important not to expose this person or this participant to a large maybe risk of this drug. So I will expose it to small members of the group or the sample. So I need a small sample size. But if I'm talking about the variance, like I'm just discussing the variance between the population. So if it's you making it larger, then you reduce the errors here. And the desired power, if I wanted to high power, that's mean reduce the sample size. If I want to avoid the type 1 errors, I mean the randomized error, then you make the sample large, because we say in the systematic error, it doesn't matter if you just make the sample size big or small, it's systematic error, it's not affected. But the randomized error, when we just discuss it, we said if you just make it larger, then you will reduce the randomized error as possible. So these are the requirements of the sample size. These are, we can say the factors that control us how many members it will be in the sample of us. And there are two types of trial. Actually, we have superior trial and we have non-inferior trial, and you think that is they are maybe similar to each other. Superior trial demonstrate that the effect size of the tested drug is superior to comparator. Okay, and also the non-inferior trial demonstrate that effect size of the tested drug is not superior to the comparator. So to know more about these informations, we have delayed it to the next lecture. So stay with us to understand what is the difference between these two trials. Thank you so much. Hope you understand anything.